Mind Matters, where we take a peek inside the human mind to understand how it influences our attitudes and behaviors. I'm Liezl Thom, and once again I'm joined by renowned psychologist Dr. Eugene Viljoen, who will help us understand ourselves and the people around us a little bit better. Hello, Eugene.
Hi Liezl, welcome back on the couch.
I'm starting to enjoy it here on your couch. Thank you so much. So, when I listen to people around me, or I watch the news, or I read a magazine, there seems to be an increase in anxiety. Is this a reality? Are we seeing an increase in anxiety?
On your question, definitely yes, but I think we need a little bit of context. And what is anxiety, I think, should also maybe be part of our definition for now. And that is, anxiety, we need to know, is part of our normal emotional repertoire. Similarly to happiness, sadness, depression, stress, all of those things make part of our emotional repertoire. And anxiety is just one of them. In the event of anxiety getting out of hand and it starts to affect your daily functioning, yes, then we can start speaking about a disorder.
So what is anxiety? How would you define it?
We need to distinguish between stress and anxiety. And there's one way that we can distinguish which one is which. And if you are maybe suffering from a stress condition or whether you are suffering from an anxiety condition. Stress in itself is determined by specific stressors that is known to you. Things like financial stress, maybe environmental stress, things like relationship stress, just to name a few examples. Whereas anxiety is just an ordinary sort of emotion of not feeling completely in control and that you are activated maybe into a fight or flight or even freeze position.
I was thinking this fight, flight, and then freeze for me came later. That's quite an interesting reaction our bodies have. Where does that come from? What triggers that response?
Initially, it comes from our ability to survive anything from the outside. So it's a reflex, and your body needs to prepare itself in the event of maybe feeling or being exposed to any danger.
Is there a way that we can perhaps train ourselves to either fight or flee or freeze? Or does it just happen spontaneously and we have no control over it?
Initially, I think we do not have any control over it. Depending on what your body perceives to be dangerous or maybe threatening on the outside, I do think that we need to be aware of the fact that we have anxiety as a way of protecting ourselves. Yes, in certain instances, that anxiety can become debilitating in the absence of certain threats, and that's when you would need help.
So anxiety is this vague sense that I'm not completely in control, but I'm not sure why I'm feeling this way.
Yes, you're right. And it is usually something that starts to develop over time. And there are certain brain structures called the amygdalas that is involved in that process. And MR scans have actually shown that people that has been exposed to long-term traumatic events, maybe even, let's say, children who's been exposed to, or maybe even war veterans that has been exposed to big danger in their lives, have larger amygdalas than maybe the normal population. And the amygdalas, which is situated in the brain, secretes adrenaline. And we know that adrenaline and cortisol would be those two elements that put your body in a physiological reaction of fight or flight, or maybe even freeze.
So when does it become a problem then? Because it sounds to me as if this amygdalas send out the message to keep us alive. When does it become a problem?
When it starts to affect your daily functioning. And many people would come to the consulting room complaining of panic attacks, and some of those panic attacks can really be quite dramatic, especially when a panic attack overcomes you at a place where you really cannot afford maybe to show people that you're in a panicky situation. Many emergency rooms also get patients on a daily basis with so-called heart attacks, and many of those patients are then rather diagnosed with anxiety disorders as opposed to a real cardiac event.
So what is a panic attack? How does it feel in your body?
A panic attack has certain symptoms, and it is, I think, on an emotional level, firstly, it is that feeling that you get that you are not in control, something is going to overcome you. What happens physiologically again is that you start hyperventilating. In other words, your respiration becomes irregular, and you start getting symptoms of giddiness, lightheadedness, maybe even pins and needles in the fingers and in the areas of the mouth. And then the feeling that you are going to faint.
And heart palpitations?
Heart palpitations and sweating is also part of that, yes.
Okay, so what triggers a panic attack?
It can be very random. Most of the people that has been suffering from anxiety disorders do not know what really triggers the panic attack at a certain time. If your anxiety levels have been coming from a long way back, sometimes you don't even need a trigger. The body triggers a panic attack by itself.
Mm-hmm. What should you do when you are suffering from a panic attack?
There's interesting things that one can do, and especially people that has been suffering from panic attacks on a regular basis, is always to keep a little bag with them, and if they do not have a bag, they can take their hands and they can cover their noses and mouth to enable the body not to exchange too much oxygen and carbon dioxide, because the imbalance in those two gases in the blood gives you all those not so nice physical symptoms. And in breathing in your hand or in a bag just brings that whole balance between those two gases in the blood back to normal.
But you need to be aware of what is happening in order to grab that bag or to place your hands over your face.
Absolutely.
How do you train people to become aware of what is happening?
I think initially, when people maybe suffer their first panic attack, they have no clue what's happening. It feels as if they're going to die, and that's why I've said that people usually go to an emergency room because of these adverse, bad physical symptoms. And when they've learned that it was, and I don't want to say merely just an anxiety attack, and I say that because you cannot die of a panic attack. So as soon as people start to realize that it is not life-threatening and that there are certain things they can do, they start to get that control back that they so desperately feels that they are losing during those attacks.
So panic attacks are caused, if I understand correctly, by a build-up in anxiety. So would it make sense then to control anxiety, and how do you do that?
Yes, I think we also need to maybe just point out that anxiety is a result of two chemical substances in your body, which refers to adrenaline, number one, and secondly of cortisol. Now, adrenaline in itself has a whole physiological cascading effect in the body where it takes blood away from certain organs in your body, for instance your stomach, and it disperses the blood towards the muscles. So in the event, if you have to run away, you need to have some form of blood supply to your muscle groups, and obviously to the heart and the lungs. In terms of the adrenaline in itself, there's all those physiological responses. We need cortisol also to maintain a healthy life. But in the event of an anxiety disorder, those cortisol levels are just not in balance anymore. And interesting enough, cortisol in itself imposes on the frontal lobes of the brain, where high levels of cortisol reduces your ability in terms of your executive functioning, which means that your creativity levels are down, your problem solving abilities are down, your logical thinking is not where it should be, your concentration ability, your attention span, and your memory gets affected by the high levels of cortisol.
So, is there anything we can do to offset all these negative points?
Yes, I think firstly you need to be aware of yourself and your environment, and if you feel that you are not in control and you do not know what it is to and what you need to do to get back in control, you obviously would need professional help, which might include two things, which is medication and psychotherapy.
And exercise?
Exercise is a very interesting one, because exercise in itself, and there's wonderful research that shows that 11 minutes of cardiovascular exercise per day sweeps the cortisol away. So exercise is a very important aspect in people suffering from anxiety disorders.
Thank you, Eugene. So there you have it. Forget about that apple. Exercise every day will keep Dr. Eugene away. From me, Liezl Thom. See you next week.